Better health begins at Tidelands Health, dedicated to keeping the communities we serve healthy and active. That's why we're proud to present our podcast series, Better Health Radio, brought to you by Tidelands Health. Here's Bill Klaproth.
Physical therapy is often required after cancer treatment to recover your strength and reduce your pain. Here to talk with us about the benefits of physical therapy for cancer patients is Dargan Ervin, a physical therapist at Tidelands Health. Dargan, thank you so much for your time today. So why is physical therapy important after cancer treatment?
Well, thank you, Bill. I'm glad to be here. Well, research, what we're seeing in the industry now, and I've been doing therapy quite a number of years, is that with the advances in cancer treatment, we're seeing a great increase in both survival rates and longevity, after cancer treatment. But the effects of the chemo and the effects of the radiation can be profound in limiting mobility and folks' ability to get around. And therapy is very important to try to help return function, and particularly safe function, so folks can get back to living after going through the treatment.
So true. So is everyone a good candidate for physical therapy after treatment?
It's just dependent on the impact that either the chemo or the radiation has on them. Because a lot of times with the radiation treatments, you certainly have extreme fatigue, and you can have joints that are fibrosed or essentially with the radiation that can be some soft tissue trauma or damage. And if you can't raise your arm over your head, or you don't have the strength to walk across the room, they're an excellent candidate because what we try to do is improve mobility and improve strength and certainly improve safety if folks are having trouble getting around.
So how do you come up with a plan then for each person? I know it's very individualized. How do you work with people like that?
Well, you do it when we have someone who's referred to us for therapy. We do an evaluation, and then identify, what are their biggest impairments. Several months ago, I had a lady who had just started chemotherapy for lung cancer, and someone who was very vibrant and active and could walk a mile or two a day prior to therapy. She was at the point where after 2 or 3 rounds of chemotherapy, she could not get out of a chair. She could not get out of a bed without her husband helping her. So what we devised was a plan. Okay, how do we work on your transfers? How do we work on coming to stand, and then working to progress into walking? And in 4 to 5 weeks, she was able to walk around her house and was actually getting out in the yard. It's totally based on meeting the patient where they are and developing a plan to hopefully get them back to where they want to be.
So whatever they need, that will dictate the type of therapy you prescribe for them.
Yes, absolutely. The other big concern with folks when they get very weak is fall risk, and we're seeing that more and more in therapy for a variety of reasons, and because you don't want to go through all this and beat the cancer and then suffer a fall where you can break a hip or break a shoulder or have a head injury. So it's just totally based on what their primary limitations are and where their risks are for some type of other injury or problem.
And when I hear you explain that, Dargan, I'm thinking of physical therapy as lifting weights and stretching. It can be more than that, right? Or is that the main type of therapy that you perform?
Well, and again, it goes back to meeting the patient where they are, because if you can't roll over or come to sitting on the side of the bed, weight training is important. So there's bed mobility training. There's balancing activities on the side of the bed. I mean, you hope to be able to progress to some weight training. In fact, the American Cancer Society recommends physical activity on a regular basis that it does include some strength training at least twice a week and 150 minutes of exercise every week. So you want to be able to get to that. But sometimes you can see the effects of the treatment is just so tough on the human body and so tough on individuals that they're not able to get there. But that's certainly something you want to work up to.
And generally, how long does a physical therapy program last?
Usually, for the most part, it's it could be 4 to 6 weeks, but it's totally dependent on how bad the impairments are that a patient is suffering, and what kind of progress they're making, and as long as they can demonstrate some potential that they can continue to improve, therapy can still be indicated for periods longer than that.
So let me ask you this then, just so people know what to expect. Who would be on the physical therapy team?
Oh, that's a great question. Because it's not just, I'm glad you brought that up. It's not just physical therapy that are important in cancer rehabilitation. Occupational therapy, where the occupational therapist would deal more with activities of daily living. Do we need any special tools to get dressed, or any special devices we need to help you with cooking or housework, or and then certainly in cases where we have trouble swallowing or loss of speech function. Speech therapy is also very much indicated with folks who in the course of chemo or radiation may have some impairments related to speech or swallowing.
Wow, that's really interesting and really important, the work that you're doing there. So what else do we need to know about physical therapy after cancer treatment?
Certainly there's probably going to be some misery and fatigue. One of the things we also see after chemo is there's some peripheral neuropathy, some weakness in the ankles and weakness in the hands, which physical therapy and occupational therapy can work with. But hopefully the patients or the families can be an advocate and know that if my family member is having trouble getting around, ask for a referral. Physical therapy, when you look at the associations, the National Comprehensive Cancer Network, they have clinical practice guidelines that physical activity and referral to physical therapy is really a part of. And we certainly want to make practitioners more aware of that, and families more aware of that. That if someone is at risk for falling, or very weak, or the other things that can happen too are sometimes family members, in attempting to help someone who is very weak, can actually injure themselves, and we certainly don't want to have the family member getting hurt trying to provide aid. And if we can improve the function of the person going through treatment, it's going to help everybody out. You're going to reduce the risk of caregivers getting hurt, as well as help the primary patient be a little more in better shape and function better and function safer.
So, Dargan, you encourage patients to be their own advocates and request physical therapy if they feel they need it. What should they do?
Call the doctor and ask for it. Absolutely. And we can see, I have seen referrals come from the oncologist directly, or if they, their primary care doctor. Because a lot of times, I've had one patient that I saw, about a year or so ago, who had effects in her shoulder residual to radiation treatment, and so she was long past the oncology section of it, and she talked to her primary care physician and said, "Hey, I've got a lot of shoulder stiffness, a lot of shoulder pain," and her primary care physician, ordered the therapy, and we got great results with improving her mobility and decreasing her pain in her shoulder.
Mm-hmm. And Dargan, why should someone choose Tidelands for their physical therapy needs?
There are a lot of great providers out there, but we here in Horry County cover from North Myrtle Beach through Myrtle Beach, Horry, and Georgetown counties, even over into Andrews, and so we have a wide network of outpatient offices and skilled physicians, oncology physicians, and oncologists, and family practitioners, and physical therapists and rehab professionals as well. So I think we have a very strong team covering a very wide area here in Horry County.
Dargan, thank you so much for your time today. We appreciate it. For more information about Tidelands Health physician services and facilities, Visit tidelandshealth.org. That's tidelandshealth.org. This is Better Health Radio. I'm Bill Klaproth. Thanks for listening.